Hi, good afternoon. I'm Rachel with Evergreen Certifications. I'm here today with Alyssa to talk about our Certified Grief Informed Professional Certification. Alyssa, do you want to quickly introduce yourself to our audience and then we'll get right into our questions?
I'd be glad to, Rachel. Greetings, everyone. I'm Alissa Drescher. I have a master's in marriage and family therapy. I am a licensed professional counselor and a fellow in thanatology, which is the study of death and dying. And I'm delighted to be with you all today to talk about this subject matter.
Well, thank you again for joining us today. It's such an honor to have you. Just for our audience, so they know, at the bottom of your screen, you'll see a QR code. At the bottom of your screen, you'll see a link, a URL, and then in the top left of your screen, you'll see a QR code. And those will take you directly to our website for more information on this certification, as well as finding coursework that will qualify for the certification. Okay, I think we got housekeeping taken care of, so let's hop into the questions, Alyssa. So first of all, if you want to start with, I'd love your opinion on why you feel a professional should get certified in grief treatment.
Absolutely. I think that being certified is beneficial for the people that we serve in our practice and also for ourselves. Most education programs, when we're entering the field, kind of gloss over the experience of bereavement. It might be tucked away in a portion of a trauma response or crisis counseling course. And yet, what we're really learning through research recently is that there are so many occurrences that a person develops a mental health disorder or symptomology that at the root of that is a significant life loss, whether that be due to a death or another loss that they experience in their lifetime. And because so many people seek out counseling for emotional disruption or symptoms that they're trying to manage, really at the root of that could be a loss. And it helps us to know then what is the best way for us to approach this particular individual. Grief is a little bit challenging for us because other things that we treat, we can find a modality and approach that is very prescriptive, step by step, and the outcome is to kind of thwart those negative symptoms just to help that person feel better, but also to mitigate some of the things that they were experiencing before. And we want that in grief treatment, but we have to create a lot of space for the fact that grief in and of itself is an adaptive response. And our willingness to sit in that with our client before trying to move them on or through, or some notion that they can be done grieving, there's an art to that that we need to know and better understand as clinicians. So I think it's really important for those people that we're serving first and foremost. But I mentioned it's also good for us. And that's because none of us are immune to experiencing losses in our own life. We all have a relationship with death, our own death anxiety, how we view and integrate losses into our lifetime. And those things will happen to us while we are practicing clinicians. And so if we don't attend to ourselves in this process and how we relate to the understanding of grief and death and dying, I'm not sure we can be as effective for the people that we're serving. So this certification gives a great opportunity to encourage a person to not only just dabble with the subject matter, but to really invest time that will benefit all of the people that they're encountering in their clinical setting.
Yeah. Well, I kind of think you answered our second question, but I'll ask it anyways. And if you have anything else to add, you can. So, what's unique about the certification and what knowledge will individuals gain by taking the education required to meet the certification?
Well, first, I would say that what Evergreen presents and offers people is a diversity in presentation, in content, and how it's delivered. You are going to walk away with so much information that is really hands-on and applicable right away to working with the bereaved in your clinical setting. Sometimes a certification might be very theory oriented, and there is a lot of theory that is richly embedded into the certification program. But on an ongoing basis, and needing the recertification over time gives an opportunity to learn what's new, what new research has come about, what areas maybe weren't first introduced when they pursued that initial certification. And it's just vital that we do that. It's our obligation to stay well informed in our very ever changing field. And bereavement research has a lot of momentum right now with the inclusion of prolonged grief disorder in the DSM, attention to children's grief and bereavement, and then non-loss or non-death loss related experiences for individuals. With such an aging population in America, we're going to start to see a lot more attention paid to this area. So it helps us as practitioners to stand out amongst our peers and our community, so that people trying to find us that are going to open themselves up and trust a clinician. They know that you have the research, you've taken the time to learn about the subject matter. And I think it really affirms for them kind of a stamp of approval that you're ready to help and address their needs as much as possible.
Absolutely. You touched on a few topics in there I want to talk about. The certification, the grief-informed certification we're talking about today, has a very wide variety of professions that qualify for mental health professionals, associate level mental health professionals. Evergreen also offers 2 other grief-specific certification, and you mentioned children. We offer one in child and adolescent, and all of that content is specific to grief with kids. And then we also offer an advanced level grief certification. Again, more education and content for the initial. So this grief informed is really a good stepping stone to be able to pursue and specialize as you're going through that process. We kind of touched on this too. After the first year of certification, we do require individuals to renew, and that involves them taking continuing education related to grief and grief treatment. If you want to talk a little bit about why you feel that's so important that people maintain their knowledge in these areas.
Oh, I do. And really, it's similar to other areas that we learn about. It may just be me, but in my experience, especially going through graduate programs and being under supervision, certain things get locked in, and I tend to go about them the same way. I'm certain that people have heard that anecdote before about a spouse who's always leaving the mustard in the refrigerator, and the other partner is saying, "Why do we leave the mustard in the refrigerator? It goes in the pantry." And there's a lot of things that we do just because of the way that we were raised. They're based on our faith orientation, our cultural background, where we live in the country, and all of those things influence us. We bring ourselves into the room when we're working with our clients and people that we come in contact with as mental health providers in any setting. And so it's important for us to pull back a little bit from those routines, pull back from those theories and philosophies that at one point sounded like this is the best way to go about things, and challenge that with recent research to make sure that we're giving the most effective treatment that we can across the board.
Oh, absolutely. Yes. So why specifically, if you want to, Alyssa, talk to us a little bit about why specifically you are passionate about advising on this certification with Evergreen and helping us get grief certifications into the market?
It's probably deeply personal for me, as it is for many people working in mental health, I think in general, and that we're inspired to do what we do because of the experiences that we've had. About 20 years ago, my daughter Abigail died as an infant. And in that experience, I realized that no one around me knew what to do. It was like I had some sort of wall set around me. And even though I wanted people to connect with me and help me through that process, they were so concerned about saying or doing the wrong thing that what I ended up with is a lot of kind of standoffish behavior, or people who were just, so frozen and not knowing how to approach that. Even within the mental health field or medical community, where I thought people might feel more apt to broach the subject, I just felt a little awkwardness in the room. And I thought at that point in time, I want to be a voice to help encourage other people who have been through something similar to find a way to better support people. And that led me to PESI and Evergreen and being a part of developing this content to make sure that there's a comprehensive understanding, again, of maybe what research is telling us and what our best approaches are, but also being an advocate and a proponent for grief as a natural normal response to loss. And the more we allow people to connect with that and engage in the fullness of their experience, their symptoms likely will typically subside over time, and they will find a way to integrate that loss into their life. And so artfully doing that, as we also consider billing insurance and doing something that we know is evidence-based and well-informed, there's a balance there. And so it's an honor to be a part of this conversation.
Well, thank you for sharing that experience. That's very touching. So now on to, I guess, the part I'm most excited about. We asked our certification holders to submit some questions directly to you. And so we're going to walk through some of those, try to get through as many as we can. So let's start out with, how can I help my 37-year-old client move forward in the grieving process? He lost his father 12 years ago and is using alcohol and drugs to avoid coping with his emotions.
Yes, this is such a great question. Thank you to the person that submitted it. It would be hard to pin down one clear, direct path forward with this particular person. And one thing that I really want to stress is that grief and loss is co-occurring with lots of other things. And so it can be hard to kind of extrapolate one from the other, or to say, now we're going to address your grief versus we know you have this substance use over here on the side, and what are we doing about that? So will be a little bit gray in my response. But I would say over time, what I see is that when there is active substance use, it is difficult to really hone in on redefining that loss for that person, to try and make meaning out of the experience, to chart a path forward. The predominant experience is related to that substance use. And so, in my opinion, my suggestion is to really focus in on what's driving that substance use behavior and treating that, so that that person might be able to be stabilized and at a point where he no longer feels the need to use and can face those challenging emotions without giving in to the use of those substances. And that takes a long time and a lot of recovery work to be able to do. What we don't want to do is to open up a big wound of a significant loss, and without him having the coping mechanisms to be able to withstand all of that tough emotional stuff that's going to come up. So I think the driving factor in treatment has to be addressing the use of substances. And if that person is not at that point where they're ready to address that, it's going to be hard to really do a lot of grief work, if you will. So I would be identifying with him, what are his goals of treatment? And I'm sure you've already done that, but to identify a treatment plan that's really driven by him, and then setting aside our goals for him, planting the seed along the way that if he works on those two things in conjunction, then they both might feel a little bit more manageable.
Thank you. On to our next question. This one says, my daughter passed away and I was wondering about some good options for therapy. Traditional therapy just hasn't helped through the years. She passed away in 2013, and although I am much better now than I was, understandably, it has changed my life, my mind, and so many things. I know things could be better, but just like her, something else is missing, and I don't know exactly what to do to help when it feels like I have gotten where I am mostly on my own. Is there advice you could suggest?
Yes, first of all, my heart is with you. I already shared that I'm a bereaved mom too. I'm sure our experiences are unique in their own ways, but what bonds us is this sense of deep longing for something that is impossible to replace, or a bucket that cannot be filled. And I understand what you're saying, that maybe traditional talk therapy or the person-centered approach hasn't been that helpful for you. I would wonder if some of that is just due to how disenfranchising this experience can be, to have the death of a child and then to try some way to go to find hope for the future and to continue on in living. And you are not alone. If we look at information through research, what we see is that bereaved parents, and often mothers in particular, tends to have a much longer trajectory in active grief or acute mourning than those that have different types of losses. And that's not to say that this is worse than other types of grief, but there is some research that would indicate, even 5 years down the road, maybe only about 55% of people in one study in particular, report that they are starting to adapt to that loss and find a way forward in their life. So I don't mean that to be discouraging, but regardless of the number of years that it's been for you, please know that you're not alone in this very long trajectory of grief. I think that what I might recommend is looking at a treatment option that's just a little bit more structured, that it takes a different approach, like CBT, for example, or ACT, acceptance and commitment therapy. Some work potentially around assessing your or being assessed for prolonged grief disorder. And I don't want to pathologize the experience of a bereaved parent, being one myself, but there might be something there for you to look into to see if that treatment approach might be better. If you can, that clinician would be taking a look at the level of intrusion that you're experiencing with, tough memories, the degree of yearning and longing that you're still experiencing at this point, how you may or may not be avoiding certain reminders or locations. And that type of approach can really be interactive, where you are kind of taking ownership for your treatment, and there might be some homework you might see in that by tracking your grief and participating in a way that talk therapy doesn't typically lend itself to. You might find some relief there. Another that you could look into is attachment informed grief therapy. There's a great book by Phyllis Kosminski that I recommend often that you could look into. And then in attachment informed grief therapy, we're really going to be looking at things outside of just the loss itself, but how does your attachment style impact all of your relationships? How is it impacting your grief? And then what is the way forward in that? So know that my heart is with you on that.
What a great wealth of information in that answer. Next question. What would you recommend for treating traumatic grief? More specifically, those grieving the loss of a loved one to suicide.
Yes, this is so important. I also want to point out in this question too that traumatic grief can be about how the person died, suicide, homicide, those types of situations, as you mentioned in the question, but they may also be how the person is perceiving themselves in the story. So did they bear witness to that death? Do they assume themselves some sort of responsibility that the death occurred? Their perception and relation to the story is also really important. So I just want to call that out too, because I think sometimes, we think about big traumas and maybe dismiss other things. I'm not saying that the author of this question is doing that, but just important for us to note that. So I'd really look at prolonged grief therapy or traumatic grief therapy that is going to, again, be a little bit more structured. But the key components here are, number one, going to be really focusing in on this violation of the assumptive world. And that is this notion that what we thought was going to happen or should have happened did not at all happen. And our perception of control in our life and our care for other people, that is threatened by this violation of the assumptive world. And so we need a treatment approach that's really going to address that. And then we need to look at some interpersonal therapy that might poke a little at our depressive symptoms. And cognitive behavioral therapy, or TFCBT, might be useful for this because it's also going to address any PTSD symptoms that might be occurring as well. I'm also a fan of EMDR. At my center, we do group EMDR for loss-related experiences that has just had really phenomenal responses. And so that's something for you to look into as well. And then one other recommendation, a personal favorite of mine, is a book called Transforming Traumatic Grief, and that's written by Courtney Armstrong. In that book, she details a model. It's 6 steps. It includes mindfulness, reprocessing difficult emotions or memories, and integrating the loss into your life through meaning making. It's very clear cut and step by step. And that's not to say that grief is something we can step by step and be done with, but for the alleviation of some of those more traumatic death related symptoms that you might be experiencing, that would be a great resource.
Okay, I think we have time for one more question before we wrap today. Can you address the grief and loss experience by our aging population? They're often grieving the loss of careers, productivity, belonging, ability, and or mobility, as well as the death of many loved ones that no longer are with them. Is there a specific body of knowledge and resource to support the aging population?
Well, I completely agree with this comment, and thank you for submitting it. There are so many levels of loss that we experience with such a long life expectancy, particularly here in America. And a lot of those things are hidden from other people's view. We might see that person retire and move away to their island location where they no longer have to show up for work. And all of us are thinking, oh, how wonderful, you must be so happy. But those series of losses that you mentioned in your question can be so profound. So, regarding your question, is there a body of knowledge or a source? I would suggest a couple of things. The Institute on Aging has some great publications that might be helpful, even outside of like the clinical mental health setting. Those will be beneficial. INELDA, which is the International Association for End of Life Doulas, has great resources, webinars, tips, and tricks for supporting the aging or dying population. So really check that out. And then the Handbook of Thanatology that's published by the Association for Death Education and Counseling is a wealth of information regarding that period of life for so many people that is stacked with losses that they're experiencing, both about themselves and the other people in their lives. So I would check those out.
Thank you. Well, I think that brings us to our time for today. Alyssa, I want to thank you so much for being not only an advisor, but joining us today and providing those fantastic answers to our customers' questions that they sent in. Any final thoughts from you before we wrap up?
Oh, I would just remember that you already have what you need to support grieving people. Being compassionate and curious and creating space for them to be with their grief experience is 90+% of the time the right thing to do and the most important thing. So lean back and remember that people won't remember exactly what you said in those early days of grief. So you can do no wrong. Just attempt to show up for them, and you're doing a really great job.
Again, thank you for joining us today. I hope